Hi everyone, welcome to Cancer Healing Journey Talks. Myself Sonali Modi from Community Outreach Team of ZenOnco.io and Love Heals Cancer. We guide cancer patients on adopting an integrative oncology treatment approach. We help them find the balance between medical treatment and complementary treatment approaches. We also help our patients with our team of oncologists, lab experts, nutritionists, and other healthcare professionals so that we can improve the treatment outcome for patients. We help in connecting patients with other cancer warriors who are going through this journey currently. So, firstly, I would like to introduce you to today's speaker, Miss Sheila. She's a cancer warrior. I'm happy that you're here with us today to share your story. So, Sheila, please start with your introduction.
Thank you so much for having me here today. It's really an honor for me to be able to share my journey with you all. So my name is Sheila. I am from Miami, Florida, and I am a cancer survivor.
Yeah. So, what made you go for the diagnosis and what were the initial symptoms?
Okay, so I started, my first symptoms were just a simple cold, headaches, constant headaches, migraines, a cough that wouldn't go away, and just shortness of breath. So I went in to see my primary doctor. They sent me medication. That didn't work. And then I lost my hearing. I was very sick. And then one day I went to go pick up the phone and I realized I lost hearing in my right ear. So that was the one symptom that really alerted me to find out, okay, something's wrong with me. It's not just a simple cold. I went to go see an ENT doctor, and they did a hearing test, and the hearing test came back, and I had complete deafness in my right ear. After studies, they did multiple studies, multiple tests. They couldn't find anything. They thought that it was probably due to a really severe infection or allergies. But I continue with the symptoms of coughing a lot, shortness of breath, having even like cough attacks to the point where I felt like I couldn't breathe for a few seconds. And then a year after all of this, I started having randomly double vision. So my right eye started coming in and I started seeing double. And that's when I decided to go to the emergency room, and they did an MRI scan of my head and neck, and that's when they found the tumor. But it was the double vision, the hearing loss, the coughing.
Mm-hmm. Yeah. So, what were means when were you diagnosed? At what stage? And what was the cancer type?
So I was diagnosed 2 years ago, February 2019, and I was diagnosed with it's called a neuroendocrine tumor called paraganglioma. And apparently it's not a very common tumor. So I was diagnosed with a paraganglioma at the base of my skull, and it was attached to my carotid artery. And I was, at that time, it was already large. It was 6 centimeters. And they told me it had started at the base of the skull and metastasized to the carotid artery. So at that point, they classified it as a stage 3 cancer.
Okay. So, how this news was disclosed to you and your family?
So it was just, I was actually, after I went to the hospital to see what was happening, they actually sent me home that night because they didn't find anything in the MRI. Or I guess they missed a tumor in the MRI. And they sent me home. And then the next day, I was at work and I get a call from the doctor from the hospital telling me that they had found something positive in the scans and that they needed me to come back immediately. So, when I heard that, I immediately dropped everything I was doing at work and I, rushed to the hospital. I called my husband and my husband went with me. And that's when they told us we found we found a tumor, but we don't know what type of tumor. We need to do more studies. And so they admitted me into the hospital, and then that's when my mom and my sister came. And after hours of testing, doing MRIs, lab work, I had 3 doctors come in, and they told me, we found this tumor after running tests, after having a team of doctors analyze the scans. This is the tumor that you have. It's not a common tumor. And because of the location of the tumor, that it's by your brain and a very complicated and risky location, we're going to need to prepare you for surgery. And the preparation is going to take, 2 months for us to make sure that this is safe for us to remove. But it was, in that moment, it was hard for my family and I to hear that, especially because I was 25 years old, young, never had any health issues aside from this. But it was nice to have family there with me, comforting there with me, and also the way the doctors came in and they sat with me and they explained everything.
Yeah. Like, what treatment did you underwent?
So after my surgery, I had an 18-hour-long brain and neck surgery. They were not able to remove all the tumor. They were able to remove most of it, but there's a part that's not, they're not able to operate on. So after my surgery, I would say, 2 months later, I did, intensive therapy, because after surgery, I had facial paralysis on my right side. I had difficulty swallowing. I couldn't eat. My tongue is deviated to the right. And so after that, I had physical therapy, intensive therapy to try to walk again, regain my strength, and eat again. And a month later, they decided that they would do 33 rounds of radiation directly in this area. And they had scheduled me for 2 weeks of chemotherapy using cisplatin and etoposide chemotherapy. Yeah, and then so I completed the 33 rounds of radiation. Unfortunately, I was only able to complete 1 week of chemotherapy, because after the 1 week, my body just started like failing me, very nauseous, very weak, and I had to be hospitalized. So I was only able to do 1 week of chemotherapy. I completed the 33 rounds of radiation. And then after completing that, they did scans to see if it had shrunk the remaining tumor, but it didn't. It was just stable. So then a few months later, my doctor reached out to me, my oncologist, and they told me about this new treatment called Lutathera. And it's a radioactive targeted therapy. So I started Lutathera. I gave it a shot. I felt like I had nothing to lose. And I completed Lutathera treatment. I had 4 infusions of Lutathera, and I completed that last year.
Yeah. So, you went through chemotherapy. So we all know that chemotherapy is a very tough routine. So what all difficulties you faced during your treatment time, and how you coped with it?
So during chemotherapy and radiation, it was definitely the hardest process for me in my life. A lot of other patients say it was the hardest battle I've had to fight. And one of the symptoms that I had, many of the symptoms I had, nausea, just feeling fatigued. I couldn't eat, and also feeling like I didn't have control of what was happening to me, which is very difficult for me. And knowing that, I couldn't really do anything, but just for me, I pray, have faith, continue to have a healthy meal, have a grateful heart every day that I woke up. So those are the things that helped me, was just like prayer, getting deeper into my faith, journaling. I started journaling, and just because it was just a lot to handle emotionally and physically. And so I started journaling. I started doing things that brought me joy and happiness. And then the other thing that also helped me was just having family and friends there for me, having that support, that encouragement, in those difficult moments where I felt, I didn't know what was going to happen, or those moments that are very uncertain. So definitely having, that support of family and friends, the community, having support from strangers that even reached out to me with encouragement, other cancer patients that also I met and shared their journey with me. That was, to me, the most hopeful part, to meet other cancer patients that had already gone through this, and they shared their journeys with me and shared, their stories, and just gave me hope that, I was going to be able to get through this, and there was still hope, even if I felt terrible, even with this diagnosis, that there was still hope for me.
Yeah. So, how did you manage your emotional well-being during those times?
So during those times, I spoke to, like, my loved ones, my husband, my mom. I, whenever there was something that was like really affecting me and hurt, like I spoke about it. And at first it was very hard for me to even speak about it. And, at first I would say 3 words and then I would break down crying. But little by little, the more I spoke about it, the more I spoke about my feelings, the more I spoke about how I felt, it helped me heal. So, I spoke to my husband, to my mom. I also spoke to a therapist at the hospital. And, she helped me see things. She gave me, she recommended I get a journal. I start writing. I focus on the things that instead of focusing on the things that I don't have, focus on the things that I do have and have a grateful heart. And then also prayer for me, praying every day, and just having faith. And, praying and having faith is what kind of helped me manage and cope with these emotions and in this period of my life.
Yeah. So generally, whenever people get this type of cancer, what should they expect from it?
So usually, this type of cancer, unfortunately, um, based on, what I went through, it's not very common, or at least it's considered rare. But I've actually found an international community of patients that have been diagnosed with this type of cancer, and it's not so rare. Um, but usually, what you can expect is, you know, it's going to be a journey, a long journey. Sometimes, these people that are diagnosed with this, it's like genetically inherited. So if you're diagnosed with something like this, you have to get a genetic testing to see if it's in your genes. You have to see a team of doctors. So you'll have a team of doctors working with you, a surgeon, oncologist, therapist, nutritionist. So you'll have a team of doctor working with you. It'll take a whole community to get you through this. And, a lot of the times the symptoms are, fast heart rate, headaches, some of the other, I had a paraganglioma, but some of these tumors secrete adrenaline. So you have that fight or flight response constantly. So it can cause people to be in that state where they feel like anxious and fast heart rate, um, constantly. And so yeah, that's it's a long journey. It's a lot of people involved when you're diagnosed with this type of cancer.
Yeah.
Yeah.
So did you made any lifestyle changes during or after the treatment?
So lifestyle changes, I made a lot of changes. I, you know, uh, before being diagnosed, I was, working full time and very stressed out. Um, so going through this made me realize that I needed to make many changes in my life. So, one change that I made is um, not like taking it slow, like living a slower life,
Mm.
not a fast-paced life like the life I was living. Uh, taking one thing at a time. The other lifestyle change I made was my diet. I, was not very mindful of what I ate before. And because, I thought I was young, healthy, nothing to worry about. So the lifestyle change that I made was I started eating healthier, eating more vegetables, more fruits, um, drinking more water. I also, the other lifestyle change is, I started viewing life differently. So I forgave family members, forgave people. Um, I didn't, try to hold anger. Um, if there was something that was bothering me, I would try to, you know, let it go, talk about it, communicate. I started communicating more with people, with friends, with family,
Mm.
about my feelings. That was something I never used to communicate about before. And, when another lifestyle change was that I started being more present.
Mm.
So, sometimes I was always thinking about what came next, the future. And the lifestyle change was I needed to be more present. So, exercising more, um, doing like meditation every day, taking a moment to um, just relax my body and like take it slowly, not be rushing.
Mm.
Um, and journal. I think for me, journaling has really helped me. So journaling every day, but definitely eating healthier, taking walks every day. Just feel like my life has completely changed.
Mm.
Yeah.
There are times when you feel that it's too much to handle, but you still don't give up. So, what was the one thing that motivated you and kept you going on such days?
So one of the things that motivated me was definitely um, prayer, prayer. Those moments where I felt so like broken down, I would pray and I would just feel like peace, and peace in my heart, but also motivation to keep going. Um, and also I say like reaching out to other cancer patients, reaching out to services available to cancer patients. Um, that kept me going and motivated. When I got involved with the community, because sometimes I think that when you get this diagnosis, you tend to isolate yourself. Um, but I am happy that I took the step to get involved with the community and just hearing other stories, other cancer patients in the process. Um, getting involved and knowing that there was, people there for me to help me, professionals, not just doctors, but also therapists, psychologists, they're available. Um, it really kept me going because I felt I was not alone in this path. There's people with me.
Yes. Because during such times, it's very important to have a support system, be
Right.
it the support from your caregivers or be it support from your doctors or medical staffs.
Yeah, I agree
Yeah.
with you. Mhm.
Hmm. So, like, what all things helped you in your faster recovery?
So what other things helped me in my
Yeah, in your
recovery?
recovery. Yeah.
Yeah. So, when it came to the physical, it was, I did, physical therapy. So even if I felt so tired, there was days where I just couldn't even get up. I made an effort to do physical therapy, and we started off, slowly, doing, small exercises. So physical therapy. Um, I also did acupuncture. So I was recommended by the doctor. I did acupuncture to help with the pain. Um, and it also gave me a little bit more energy. Like I would come out of acupuncture and I would feel more energized. Um, I saw a nutritionist, so I, started being more mindful of what I ate.
Hmm.
Um, and yeah, and then just, listening to my body, listening to my body and being more active, but also learning when to take a break.
Hmm.
So I did yoga, acupuncture, physical therapy. Um, I, got involved with the community, and that helped like my recovery and taking it one day at a time at my pace. It wasn't the pace that I used back then. Um, 25-year-old, like really fast, but it was a slower pace, but I took it at my pace, and every day I improved more and more.
Hmm. Basically, valuing this every small thing in your life.
Yes.
Hmm.
Yeah.
Every crisis in life teaches you a particular lesson. So, what life lessons have you got from your cancer journey?
Oh, there's so many life lessons. I've learned to, you know, not take every moment for granted, and really appreciate every single day, because it's like, it's not saying tomorrow's not promised. And for me, that's when I wake up every day, I say tomorrow's not promised. And, you gotta live each day, like it's your loss. So for me, it's just being present and fully present for myself, fully present for family. When I have family over or friends over, just being fully present there with them, not on my phone, not, thinking about other things, but just being fully present in the moment. Um, the other life lesson I've learned is to not be scared. It's normal to feel like scared and to have fear, but to not let that control me or paralyze me. Um, so to know, okay, I feel this, but I'm gonna step out and do what my heart's telling me to do. Um, so knowing that my faith is greater than my fear. Um, and the other life lesson is, to be patient with myself. Like sometimes we're so hard on ourselves, um, and just to appreciate myself and to have more grace with myself.
Hmm.
Um, and that, it's okay. It's okay if you fall down. It's okay if it doesn't work out. There's better things that lie ahead for you.
Hmm.
And I would say the other life lesson, um, was just like I guess trusting that, everything will work out in my favor. It may not be how I planned it. It may not be how I mapped it out. I thought it would be in my head. But everything's going to turn out better than how I imagined.
Mm.
And, the other life lesson was to let go of, like, forgive. And that for me was like, forgive myself for the past, forgive other people that, have hurt me, um, and, learn to forgive people and live with a grateful heart. Yeah.
Yeah, definitely. So, do you think that cancer has changed you in a positive way?
Yes, definitely. When I was going through it, when I was diagnosed with cancer, I asked myself, like, why is this happening to me? Um, you know, what did I do to deserve this? Am I
Mm.
being punished for what I've done? Um, and in that moment, I didn't realize. I thought you know, my life was ending. But now I see that it taught me so much, and it's changed me so much, and um, and I think it's definitely made me a better person because now I see what life is about and I see what matters in life. Um, I realize how important time is. I realize how important spending time with family and loved ones is. Um, and it's taught me to really learn how to live.
Mm.
Back then I thought I was living, but I was just working, going to work, coming home, sleeping, and then doing it all over again. Um, and I felt like there's no purpose in my life, and I wasn't really living. Um, and then now that I've gone through this, I've learned that now I feel like more alive than I felt before.
Mm.
Yeah.
So, gratitude seems to be the biggest strength to fight this kind of situation. So, what were you ever so grateful for that made you always calm down after thinking or revisiting that memory?
So whenever I, relive that memory, and I would just take a deep breath. It's so simple, but just like breathe in, um, like close my eyes and then just breathe. Um, you know, Prayer. I know I've said it a couple of times, but that really helps me meditate, um, and journal. Writing down my thoughts, writing down or how that made me feel back then, or how when I think about it, what makes me, how am I feeling in that moment? So journaling, and then just pausing. When I rethink of that, and I pausing what I'm doing, stopping what I'm doing, and then just focusing on my breathing,
Mm.
and focusing on the how far I've come. You know, um, not everything, not focusing on the pain and the suffering that I went through, but looking back and seeing how far I've come and how much improvement I've made, um, since being diagnosed.
Yeah. So, like, how is your life after cancer?
Uh, it's been difficult. Now I'm finally starting to have more energy, and it's been 2 years since my diagnosis. Um, the first 2 years it was difficult. It was treatment after treatment, in and out of hospital, was in and out of doctor appointments. But now, I thought a few months ago, I thought, okay, I'm done with treatment. Now I'm ready to step out into the world and, get out there. But I realized that my body was still healing. It would take a process. It was a process for me to get back out there. That I had just finished, I had finished treatment, but now I had to slowly, heal to the point where I felt like, okay, I'm ready to get back out there. So I continued, even though I finished my treatment last year, I've continued with like physical therapy. I do acupuncture. I continue to focus on my health, on my body. Um, Years later, I'm finally, volunteering with the hospital. Um, I still haven't gone back to work because I still feel like there's moments where I still get tired. I'll cook and then I can cook now because before I couldn't even cook. Now I can cook, but after I cook, I have to take a break. So I can do more things now, but I still have to take breaks in between. So I can, clean my house, cook, but I have to take breaks. So, now after cancer, I've learned to slowly like listen to my body. And I'm getting more involved with the community, volunteering, being more involved here in my home. But definitely taking it's been a healing journey.
Mm-hmm. So do you have the fear of recurrence? If yes, then how you deal with it?
Yes. So, I don't get fear as much anymore. Just because I've gone through so much and, so many times when I've been up and down, and I've seen how far I've come. So I don't get as fearful anymore. I don't think about it as much. But on the days that I do think about it, it still comes up. It comes up in my mind, especially when I'm feeling bad, or on those days where I feel like pain, where I feel bad. Those are the days that I start thinking, what are the possibilities of this coming back? What if it comes back? And on those difficult days, I um, I listen to my mind. I listen to those thoughts, but then I bring myself back to thinking, you've already made it this far. You've already gone through so much. You've already gone through radiation treatment, um, and I pray, and I ask God to give me that peace, to take away that fear that's in my heart. And then I'm reminded of everything that I've already been through, and and I focus on like the present moment. So, there's so much that I can think of that can possibly happen in the future, possibly growing or happening with a tumor. But I bring myself back. I close my eyes. I take a deep breath in, and I remember, okay, right now, focus on the blessings that you have right now. Focus on the today, on the present.
Yeah, because live in the present and live your life to the fullest as much as possible and not to worry about the future.
Exactly. Yeah.
Because things will happen eventually.
Exactly. Mm-hmm.
Yeah. So, like, what was your first reaction when your reports were finally showing that you're cancer free?
I cried. I cried of happiness, of joy. Um, for me, it was a slow progress because I still have some tumor activity, but when the doctors told me the tumor has shrunk, I cried. I cried of happiness because it's just been a long journey. It's been 2 years of, fighting and treatments, and and just to finally see some light and see some improvement, I was just filled with so much gratitude in my heart.
Mm.
Yeah.
So, do you still go for prescribed checkups after you are declared cancer free?
Yes, yes. I still have checkups. Every 3 months, I have checkups with my oncologist. They do blood work. They every 6 months I do scans. I actually have a scan this Friday, just to follow up. So every 6 months they do a PET scan and they do an MRI scan. And then every 3 months they'll do labs. Um, just because after my last treatment, my thyroid levels have been high. So I've been on thyroid medication. So they check that, make sure that the thyroid is stable, um, and then to make sure that my labs are stable. So yes, I continue to have treatments with my doctors, with my surgeons. I see them once a year. Um, so the surgeons that did the surgery, I see them once a year, sometimes twice a year. Um, so yes.
Hmm. So, what was the pivotal turning point in your life?
The what? I'm sorry.
Pivotal turning point in your life?
Um, like the pivotal point you said.
Yeah.
Pivotal. Yeah. And I mean, it was. I think it was right after surgery. Right after surgery, I I was just so grateful to have come out of surgery. Especially because it was such a complicated surgery, and they told me that it took me 2 months to prepare for surgery. We were all scared, didn't know what was going to happen. And it was an 18-hour long surgery. I had 3 surgeons operating, my head and neck. So when I woke up from surgery, for me, I just felt grateful to be alive, grateful to have survived, um, and grateful to be breathing and have another opportunity, a second chance of life.
Yeah. So, if you have to sum up your journey in one sentence, then what would that be?
I would say my journey has been long, but it's transformed me.
Yeah.
It's transformed. So it's been a long journey, but it's been a transformation and a breakthrough for me.
Hmm. So, your story is really inspiring, and I hope this session really motivates people out there who are traveling or who have traveled through this journey. So, it was lovely having you here today on the session with us, Sheila. So, once again, thank you so much for your valuable time.
Thank you so much. I'm so grateful to be here. Thank you for listening to my story and sharing my story. And I really hope that it can inspire and bring hope to many cancer patients.
Yes, it definitely will. Yeah, thank you.
Yeah, thank you